So what happens in cardiogenic shock? So cardiogenic shock is a problem with the pump. So again, pump, piping, volume. In this case, we have a pump problem. So cardiogenic shock is a condition in which the heart is not pumping effectively. When the heart is not pumping effectively, we lose stroke volume, you lose cardiac output, and it could be from bradycardia, so a heart rate so slow that a heart is not pumping adequately, or a heart rate so fast, the ventricles are not filling adequately, so when the heart does contract, we have a decreased stroke volume. Or it could be a combination of things. And so what are some possible causes? So what might cause a decrease in heart rate? Well, think about it. It could be a multiple things, but could be a heart attack. So if somebody's having a myocardial infarction, then that's going to impede the electrical conduction of the heart. If we impede the electrical conduction of the heart, we decrease the performance of the heart. And we decrease the performance of the heart, we decrease stroke volume, may decrease heart rate, and that's going to lead to cardiogenic shock. So could be a cause from acute myocardial infarction, congestive heart failure, and other components of cardiogenic shock is abnormal cardiac rhythms. That could cause the bradycardia or the tachycardia, but also it may cause some deadly rhythms such as ventricular tachycardia, ventricular fibrillation. Now those are shockable rhythms that we'll talk about later on, but right now those are some of the deadly lethal rhythms that, if not corrected quickly, will lead to the patient's death. So, and a lot of times if we're treating our shock patient and we suspect to have cardiogenic shock, then these patients can benefit from ALS treatment, such as additional medications. We can increase the heart rate, we can slow the heart rate. We can also help with our blood pressure with some vasoconstrictors. So that's all the form of cardiogenic shock. So what's the problem with cardiogenic shock? It's a pumping problem. So ultimately, why is it a pumping problem? Well, it could be a heart attack. It could be electrical disturbance of the heart. It could be heart failure. So recognizing cardiogenic shock and knowing how it separates itself from a distributive shock or obstructive shock or hypovolemic shock. So they all have this different signs and symptoms that you must be able to recognize.